your host, Amberlyn Carroll. Thank you for joining us on this episode of Medwatch today. Ovarian cancer can be difficult to detect in its early stages because patients sometimes don't experience symptoms. And while ovarian cancer starts in a woman's ovaries or related areas, it can often go undiagnosed until it's spread to other parts of the body.
Ovarian cancer is a tough disease, and sometimes we call it a silent disease because it doesn't give a whole lot of symptoms.
Dr. Trung Nguyen is board certified in Gynecologic Oncology, a field of medicine that focuses on cancers in the female reproductive system, and says ovarian cancer causes more deaths than any other cancer of the female reproductive system.
It has a very high mortality rate, and it's very problematic. Because it's difficult to diagnose this early.
Because the ovaries are located deep in the pelvis, the cancer can be harder to detect.
The ovaries living in the abdomen, there is no barrier around it, meaning if there's something wrong with it, and there's mass or cancers that are growing out of the ovaries that can readily extending out to the rest of the abdomen.
Bloating, diarrhea, and abdominal pain are the most common symptoms of ovarian cancer and also some of the easiest to overlook.
I wasn't feeling myself, and I felt lower pelvic pain, and I would be at work and I'd use the restroom a lot.
Afra Saleh visited her doctor hoping to learn what was causing her pain. She was diagnosed with stage 2 ovarian cancer and immediately referred to Community Cancer Institute because of the level of care and treatment she needed.
Surgery is a key component of ovarian cancer management. Chemotherapy or systemic treatment is vital.
In addition to cancer treatment, Community also provides genetic testing for patients who are at high risk for cancer or have been diagnosed with a genetic mutation.
There's two types of genetic testing. There's germline genetic testing, which tests kind of a blood test or all the cells in our body, and it's something that's inherited or passed down. We also do somatic testing, which means that we test the tumor itself. So we actually send tissue samples of the ovarian cancer tissue type once we have performed surgery.
Dr. Jana Freeman is fellowship trained in gynecologic oncology and says this type of genetic testing opened a door to try a new class of drugs called Lynparza that is very effective for genetic mutations.
Our clinic is really made so that the genetic counselor and our medical geneticist can come counsel the patients and help them with their family, but also help the patient navigate.
Afra underwent genetic testing and discovered she had a genetic mutation called a BRCA gene. Afra credits Dr. Nguyen and his team with helping her not only get answers, but access the care she needed to survive.
I don't know how I got through it. I was optimistic, and I had my family and Dr. Nguyen and their team. They gave me hope.
Afra says she shares her experience, hoping others can also find answers before it's too late. And to remember,
if they know anyone in their family that's had cancer, to get checked.